You walk into this room with seeing all these isolettes and all these tiny little babies that half of them don't even look like babies.
She was smaller than a loaf of bread.
Not even big as a football.
Her fingers like a piece of spaghetti.
But she was a perfect little baby. I mean, she was just miniature.
All I could think was, God, they're beautiful, even though they're so tiny. They were ours. They were our babies.
According to nature, a pregnancy is supposed to last about 40 weeks, culminating in the birth of a full-term baby. But about 12% of babies come early. When a baby is delivered before 37 completed weeks of pregnancy, the birth is considered preterm or premature.
When we talk about babies that are born prematurely, we typically think of babies who are born low birth weight, weighing less than 5.5 pounds, and being somewhat immature.
In general, premature babies are tiny, and they have a whole host of problems, most of which are temporary ones. But they could be problems like just the most basic one, not being able to stay warm without some very extraordinarily high kinds of extra heat, not having full enough skin just to keep all the moisture in, not having mature enough lungs to be able to breathe well, sometimes having some problems with the way the blood flows out of their heart that require some very special kinds of treatment, not able to eat yet, not able even to have the intestines working, and not able to suck and swallow and do all those basic kinds of things.
To overcome these challenges, premature babies often need the high-level medical support that is provided by doctors and nurses who specialize in neonatal or newborn intensive care.
The basic premise of newborn intensive care is to buy time. Maturity is going to occur naturally with time. And if no complications develop, and if we can help that process or accelerate that process, it would move in a very orderly fashion towards baby graduating from a neonatal intensive care unit.
We're the supportive safety net that keeps the baby in good shape until all those systems mature.
In general, the earlier a baby is born, the more support the baby is going to need to grow and thrive. The smallest babies, for example, the so-called micro-preemies, who are born earlier than 26 weeks gestation, face greater risks than more mature preterm babies.
If your baby is 24 to 26 weeks, that baby is at the margin of viability. So it's a very risky time. Almost all of those babies have significant breathing problems and are on respiratory support for anywhere from days to weeks to sometimes months. To show you what a difference just a few weeks makes, in the babies 28 to 30 weeks, which although the majority still have breathing problems, but usually they're not as severe and those babies do not require respiratory assistance for as long a period of time. So just a few weeks difference as you move along the line makes a big, big difference as far as gestation and the problems the babies run into.
All premature babies who are admitted to a NICU need some help in making the transition from womb to world.
For premature babies, the first 72 hours are really the most critical. It is typically the time when the lung function is at its sickest in terms of the amount of support the babies need. Usually, once the babies get beyond that 72 hours, although there are still many concerns and many types of problems that the babies may experience, they are usually not as severe.